This is my 8-factor model for the United States by Giselle Guzman. Historical beginnings of healthcare in the United States began around the 19th century when the industrial age began. There were a lot of machineries, accidents, and workers had no compensation. So if they didn't work, they had no money. The union are the people who began to work on a way to make sure that workers were insured after injuries or if injuries happened. Union workers that worked in the factories developed plans for the employees to be covered from injuries and illnesses. It was far from perfect, but it was a beginning at that time for the Industrial Revolution era. President Theodore Roosevelt was in office from 1901 to 1909. He believed that no country could be strong if the people were sick and poor. So President Roosevelt tried the beginnings of trying to find a way to reform health in the United States, but insurance companies fought him very hard because without the people seeking insurance from the private insurance companies, it put them out of business. So they were trying to keep the government from developing a plan. And the government leaders also believed that it would make them more socialist because the United States at the time still believed in capitalism. World War I began in 1914. During this war, the War Risk Insurance Act was provided for soldiers that were injured and for their dependents later on. This meant that if any of the soldiers had their arm blown off, they were compensated for their injury. It also helped the dependents, in case the soldier passed, they would be able to make a way of life until either the mother remarried or they found a job to support their family. Social Security Act was passed in 1935 by FDR. It covered the blind and the handicapped, and this is one of the programs that is still in effect today. The structure of healthcare in the U.S. In the United States, we have many hospitals and clinics. Most of our hospitals are specialty hospitals. We have some that specialize in surgeries and oncology, pediatric hospitals, just different types. And we have some that are private owned or they are public owned. All of our computers inside of the U.S., we have up-to-date computer programs. We have forms of electronic health records. We're able to send off scans and radiology and have them back in a matter of minutes to hours. And all those scans can be included in the electronic health record file, or they can be used as paper files, but right now we are moving away from paper files and onto electronic health records. The types of medical staff available in the United States, the nurses, we have different levels of nursing. We have registered nursing, licensed practicing nurses, certified clinical nurses. We also have different types of doctors. We have oncologists, urologists, we have general doctors, pediatrics, and OBGYNs. We also have different levels of medical staff. We might also have secretaries. We will also have phlebotomists. There's just different levels of medical staff, and there is a short supply right now in nursing, but admissions for doctors are fairly easy, and schooling for nurses is also fairly easy if prereqs are met. Financing in the United States, the health that we have, the healthcare provided in the United States, we have Medicare and Medicaid, and it is covered through payroll taxes. The state also contributes, and so does the federal government. Medicare is developed for the people over the age of 65, as well as Social Security is a monthly income that people over 65 receive. Medicaid is for lower income families. There's a division of CHIP that is for children, and it provides health coverage for low income families. The Affordable Care Act was passed by former President Barack Obama, and it is funded through taxes, the government, and the individual. In the Affordable Care Act, we see that there are subsidies given by the government to help people not pay such high payments for health coverage, and it makes it affordable for those with lower incomes. In the United States, our interventional, insurance companies have a lot of control over what the doctor says. So most of the times we get to a doctor, we think, is the doctor really listening to me? You tell them something hurts, and they might not do the test that you think you might need. But they sometimes are helping you because you might not need that certain test, because insurance companies sometimes refuse to pay for certain tests. It is known that some doctors do argue with insurance companies to try to get their patients to get coverage from the insurance company for certain tests and diagnostics. Preventive care in the United States, we have vaccines that have been developed throughout the years. Most of them keep away chickenpox, flu, polio. It has helped us maintain, a good way of life. Disease-free epidemics going on everywhere. We also, many doctors and clinics recommend yearly checkups, bi-yearly checkups. We usually see those from our dentists and our eye care specialists. We encourage regular checkups. Health departments are available in every county to help those who might need coverage or not coverage, who might seek care, which they'll do small procedures, they'll do some vaccines. If you haven't been to a health department, you should probably check them out. Major health issues in the United States, we have heart attack, which is ischemic heart disease, which can be the hardening of cholesterol in the arteries and the reduction of size of the artery, and it leads to heart attacks. Strokes are also a major problem in the United States, which means that the blood supply to the brain is cut off, and it causes the person to either go numb in their body or their face droops. There are signs to help you identify that. And then the third largest cause is lung cancer. Most people in the United States smokes, and tobacco is a large problem. There are programs in effect to help with lung cancer. I remember the RAT program and the commercials that used to come on TV. That's it.